Angelina Jolie recently revealed that she had her ovaries and fallopian tubes removed. It follows a double mastectomy she had 2 years ago after she discovered that she was a carrier of a mutation of the BRCA gene.
For more, we're joined by Dr. Sue Shanley, who's the Acting Director of the Peter MacCallum Familial Cancer Centre. Good morning to you, Dr. Shanley. Thank you for joining us.
My pleasure.
We understand with the first procedure that someone as famous as Angelina Jolie undertook with the double mastectomy some years ago, that there was an increase in the community for those people who suspected risk of familial cancer taking up medical treatment and investigating that. Are we expecting something similar here now with this subsequent treatment that she's undergone?
It's possible that we might see an increase in interest, but perhaps to a lesser extent, given the fact that ovarian cancer is a less common cancer than breast cancer. But we're still very much aware of the fact that it may increase people's interest in getting in touch with us, and we're happy to help field inquiries if people are concerned. But I guess the main point of first contact is probably for people to have a chat with their GPs.
Can we just background then why Angelina Jolie has gone down this route as far as her own health is concerned? It comes down to she carries the gene mutation BRCA1 and 2, or is it just 1, and
BRCA1.
Otherwise known as the BRCA gene.
That's right.
Can you just talk us through that, what the implications for her and her predisposition for cancer?
Yeah, so it's an inherited mutation in a DNA repair gene. So we all have these genes, but if you have an error, which is a mutation in one of them, it doesn't mean that everyone's going to get cancer, but it increases the risks for women predominantly of breast cancer and ovarian cancer. And the risks vary a little bit depending on which which gene you have. So for her, it basically meant a lifetime breast cancer risk of the order of about, say, 60%, and an ovarian cancer risk of potentially up to around 40%. Our role in familial cancer clinics is to help people to put that risk in context, to particularly understand when in a person's life that risk may be relevant, and to help them work their way through the choices that they have in managing those risks.
So what would some of the factors be? Is it not just the fact that you may have other members of your family who've had incidents of cancer? It may also be factors such as age?
Yes, that's exactly right. So one of the factors is what your family history looks like, and we hope over time to be able to understand what are the other genes that interact with the BRCA1 and BRCA2 genes to actually explain risk in a slightly more refined manner. But certainly age is a critical factor, because really the breast risk for BRCA1 carriers is predominantly relevant after the age of 30. And the ovarian cancer risk is predominantly relevant after the age of 40. So we're trying to help women to make decisions about managing that risk, giving them the message that they've got time to do some fact-finding, that they've got time to plan their families, and then to think about the mainstay of managing risk, which is having your ovaries removed at around about the age of 40.
Yeah, that is, of course, radical surgery. How does someone arrive at that decision? Obviously, after talking with their healthcare provider, the doctor, and so on. Given, obviously, the idea is to mitigate the chances of developing cancer, but given it is so radical, very intrusive, how does someone actually arrive at that decision? Do they simply weigh up the risks?
Yes, I think Angelina's piece illustrates the fact that it's a very considered decision, and that the process of making that decision involves talking to a range of health professionals, and also talking to peers can be helpful. Some people like to have a fairly numerical discussion about the level of risk and how that risk is distributed over time. Yes, it's a weighing up of the risk of cancer versus the potential side effects from surgery. And we're trying to help women to understand that there are many measures to help deal with side effects from surgery, and that everyone deals with or experiences the side effects of surgery in a different way. So it's not necessarily that everyone will experience significant menopausal symptoms if they have their ovaries and fallopian tubes removed. But we are generally recommending that women have a hormone replacement therapy up until about the age of roughly around 50, 51, when they would have otherwise gone through menopause, to help look after their general health. So yeah, there's a range of health professionals involved in making these, in helping women make these decisions, from familial cancer clinics like ourselves, gynecologists and menopause clinics.
Dr. Susan Shanley with the Peter MacCallum Cancer Centre, thank you so much for your time with us this morning.
My pleasure.
Let's take a look at the satellite. A trough over Western Australia's interior is causing a few showers and thunderstorms. Moist onshore winds feeding into another trough over Queensland is triggering some isolated showers, and a low in the Tasman Sea is creating gusty conditions for the southeast of the country.